Welcome to the Cheer Athlete. This week, we're going to discuss what catastrophic injuries mean in cheerleading. Catastrophic injuries often include severe spinal cord injuries, cerebral injury, meaning brain injury, and other life-altering injuries. This is important for cheer athletes to know because although they are not super common, cheerleading is one of the highest female sports in catastrophic injuries. I do think it's important to talk about and talk maybe about some ways that we can reduce injury risk. Welcome to the Cheer Athlete Podcast, where we bring coaches, parents, and athletes expert tips and advice to help keep cheerleaders healthy, strong, and at the top of their game. Now let's go. So cheerleading is more than just on the sidelines. Back in the day when I was cheering and I was in high school, we didn't compete. I was just on the sidelines and we would jump. There was some that would tumble. It wasn't like to the extent that we're at today, but there was some tumbling. And we would build low-level shoulder stands, shoulder sits. I don't think even at that time we were building preps. Now, when I got to college, I started stunting more. But back in the day, it was very low level. Now we look at cheerleading and, between All-Star and high school cheerleading, college cheerleading, and the stuff that we're doing on nationals, like it's really advanced. And we are asking a lot of physicality in our athletes in growing. And we have evolved so that we are learning those skills. In doing those complex stunts and the tumbling that has progressed into crazy, some of the stuff I've seen, it can create a real physical risk. And if an athlete is not prepared, that can lead to an injury. The catastrophic injuries, again, like I said in the intro, they're rare compared to total injuries, but cheerleading does account for the majority of catastrophic female injuries in sports and female sports. Cheer still accounts for 65% of all catastrophic sports injuries in female high school athletes in the US. And this includes head, spine, and serious trauma. Most catastrophic injuries have been found to occur at practice and not during competitions. And likely that's because we're starting to learn a new skill. We have to take a little bit of risk as we're learning something new, but we also need to really make sure that that athlete is ready to take on that new skill. So what type of catastrophic injuries do occur? Concussions are the major concern in cheerleading. They're usually caused by a fall during stunts, potentially could happen during tumbling and landing on your head, but specifically falling from the stunts and basket tosses and pyramids are probably the two biggest drivers of those concussions. Surprisingly, it's not necessarily the flyer that's getting a concussion, it's usually the base. It can happen from just bumping heads. A flyer can get it from traumatic cradles and from the brain kind of sloshing about in the cranium. It's not exactly what happens, but there is a little shift in there that can create trauma to the brain. Some studies suggest that concussions may make up 30 to 31% of cheerleading injuries in youth athletes. This was a systematic review of cheerleading injuries by CENG in 2025. They're the ones who found this information for the 32% of cheerleading injuries in youth athletes. Severe brain or head trauma accounts for a large portion of catastrophic cases. And in one data set of catastrophic injuries, 52% were head injuries and 32% were cervical spine injuries. And this was from another stat from that same article in the systematic review of cheerleading injuries. And they looked at the epidemiological review information. So acute traumatic brain injuries versus repeated concussions. So acute traumatic brain injury would be something that they come down and they really smack their head and it creates, maybe they come down and land on the floor and hit their head on the floor, and that creates acute brain trauma. And then a repeated concussion is another brain injury that happens, from, again, the repeated basket tosses and the landings. And when we whip our head back and then come down. Now, not every cheerleader is going to get a concussion with doing this, but it can happen. So we need to be aware of it, and we need to know the signs of a concussion. We used to think it was just if they were blacking out. Now we know that it's not. It is even just kind of getting the not the wind knocked out of you, but you kind of get your brain jostled a little. That's exactly what's happening. And so we need to, pay attention to that when they're coming out, and maybe make them sit for the remainder of practice and get seen by a physician to get cleared. They actually refer them to the athletic trainer on site. And if you don't have an athletic trainer on site, talk to your athletic director if you're in a high school setting. If you are younger and youth athletes, like, see if you can get your organization to hire an athletic trainer, because they are amazing and phenomenal at making sure that our athletes stay safe. Other signs of a concussion may be, that they are having double vision, that they have a headache. Those are all classic signs. And when we talk about getting them to return to play and how they're recovering, we want them to be symptom-free for 24 to 48 hours, longer if possible. I like to see them out for a week, and then gradually ramping up, and they have to, get their cardiovascular, they start maybe, taking a walk. I absolutely think they have to be going, to class, and they need to be able to participate in gym class. They can't do that, then they shouldn't be at practice. But once they are not fuzzy, they have clear vision, they can do their schoolwork, they can participate in all of their classes, and they have started to challenge it, and they're not being symptomatic, then they are generally cleared to return into sport. When we don't pay attention to this, the second impact syndrome that can happen actually has more severe consequences. If somebody has a repeated concussion, especially in that short amount of time, it creates a lasting effect. And then that creates a bigger problem for the cheerleaders down the road. If you're noticing a personality shift and a personality change, maybe it's depression, maybe it's anxiety, all of those can be lingering effects from a concussion. So really pay attention and seek help to get them back into, and there's, they're in Boston, we have Children's Hospital, and they have a fantastic concussion program and protocol. Some of that might involve going to physical therapy to work out the neck tension, to build up neck strength, to get them doing activity again. Some of it may be having them go see a neurologist or having them work with a sports psychologist. All of that to help get the function back in their brain and to really help them be healthy again. We talked a little bit about acute traumatic brain injuries. When I was shortly after I had started working as a physical therapist, it was my goal to work with traumatic brain injuries. You think like car accident, potentially stroke, and someone that's, had a significant blow to the brain. The clients that I worked with hold dear to my heart, and they usually were in there for long-term care. I had one, I think he was a 9-year-old boy who fell off a bike, and I think he was clipped by a car, but he fell and hit his head and had a severe injury. And when he came in, it was pretty low functioning, not speaking. He couldn't move on his own. But over the course of the time that I worked with him, he ended up going home with his family, and his family kept in touch. And he did end up graduating high school. But it was a really traumatic injury, and it took him a long time to get any function back. These are really severe, and they're not common in cheerleading, but they're things to be aware of, and it's stuff that we don't want any athletes to have to go through, especially child, to have to go through. So something to just be aware of. Spinal and neck injuries, that's another traumatic and catastrophic injury. They can lead to disability, even like a spinal cord injury. They did find that there was some cervical injuries. If you have a spinal cord injury, even if it's a bruise, it creates long-lasting effects. If you have an injury to the spinal cord that's severed, the head either snaps back, if they land wrong, and that can create paralysis and a quadriplegic, depending on where the level of injury is. And if it's high enough, it could potentially lead to death. I'm not saying all this to scare you. I don't think that these are super common, but they can occur, and they have occurred. So we just need to be aware of them and making sure that we are keeping our athletes safe, and not being aware so that we are afraid to do anything, but being aware so that we can make sure the athlete has the right skill before they're progressing on. Injuries can happen. I talk about that all the time. but making sure that they're ready to go and that they're not doing things that are not safe, that they're not practicing without a coach, that they are not practicing and throwing stuff on hardwood floors that they shouldn't be doing. Stunts involving inversions, tossing, pyramids, get the flyers higher off the ground. And then if the bases aren't ready to catch them, or the flyer hasn't mastered the skill to be able to know how to land, that can create that a severe fall and potential for spinal cord or head injury. And a third catastrophic injury that is not, I think, the concussions, the head injuries, and the spinal cord injuries are the most catastrophic because they are life-altering. Fractures and orthopedic injuries are catastrophic and will keep an athlete out for a significant amount of time. Broken bones like wrist bones, wrist fractures, arm fractures, collarbone, clavicle fractures occur when you land awkward and you have collisions. I broke my left clavicle 3 times as a young. I was 6, 9, and 12. I slipped on wet grass the first time trying to do a cartwheel, and learning the second time I was in gym class and I was trying to spring up out of a forward roll and I landed wrong and broke it. And then the third time I was trying to do a front walkover and I just wasn't strong enough and my arm gave out. I think that put enough fear in me that I never learned to tumble after that. It wasn't so prevalent when I was 12 years old to know that. And the doctor, I remember, when I had to see my pediatrician, he's like, if you do this again, you'll never wear a sleeveless dress. And I don't really care about sleeveless dresses, but like, I wish he had addressed the function. Like, just a collarbone fracture, it was painful. I needed help sitting up from lying down. And, I'm still aware of where that fracture site was. Now, it doesn't limit me. I have some limitations in shoulder motion, but it's probably because I'm old. But it was traumatic, and it took 6 weeks in a butterfly brace to hold me back and let things heal. I think ankle injuries are ankle fractures are very common in cheer. You land wrong out of either a stunt coming down and you land wrong and kind of twist the ankle severely enough that you can break your ankle, or you land wrong out of a tumbling sequence. And general bone healing is 6 weeks. Now, a fracture is the same thing as a broken bone. Some people are like, oh no, I didn't break it, it's just fractured. It's the same thing in medical terminology. Stress fractures are more repetitive strain than a actual land wrong, break a bone fracture. But the healing time is around the same. And that's for that bone structure to reheal and come back together. If they have a fracture, they're sitting out for 6 weeks. I like them if they get a repeat x-ray at 4 weeks, the bone may be healing. But I think waiting that 6-week time frame to start doing impact is important, so that you have to start to walk again, you have to be able to weight bear. And so building up gradually and making sure we have the strength to get back into what we're doing can help prevent a further injury. And then if you think of a catastrophic spinal, it could be a spinal cord injury, spinal vertebrae, or complex trauma. Generally, the spondylolisthesis or spondylolysis doesn't usually happen from one traumatic event, but that happens over the course of time. We talked about this last week in the overuse injuries, but that is a fracture in the spine. And while things will heal, and the treatment is go to physical therapy and build up core strength and build up strength in and around and learn how to move better, we do have to be aware of these, that, are they having repetitive pain? And if so, let's pull them out and teach them how to move better so that they don't have this pain. Getting the time to heal, I think, is extra important. And then when they do heal, getting them back into normal function, making sure they have the right range of motion, that they have the strength, and that they can, because if a base broke her ankle and 6 weeks she's cleared by the doctor to get back in, but it's still a little tweaking, she doesn't have full motion, as she's going to squat down, if it just tweaks just a little bit, she may drop the flyer. And then the flyer might land on her head. They all land on the ground. They bump their head, and she's out another 6 weeks with a concussion. Obviously, I'm exaggerating, just trying to give an example of what could happen. But I think it's just really important. Like, we need to pay attention and make sure that they are fully healed, they have their strength, they have their motion back, and that they're ready to go, and not asking them to get back in too soon. I know, I very much understand, like, you, especially if you're in all-star world, you want your athlete back because you paid so much money for them to be there. And we are a team sport. Our team relies on us to be there. But it's more important to look out for the health and safety of your athlete than trying to push through. And it's one season versus potentially a whole career. Other injuries that I consider traumatic, maybe ACL and other knee injuries such as meniscus, they will happen during landing. So potentially landing on a jump, landing tumbling, or even coming out of a stunt and landing wrong. It could happen for a base or a back spot if the stunt is moving and you just kind of hyperextend and rotate a little bit. I'm sure you've seen a video of an athlete going down, landing out of a jump, and then kind of hobbling to her next spot. You can walk on an ACL injury, but having had one and an MCL injury at the same time, it hurts like the dickens. And your knee feels like jello when you walk on it. As I'm recording this today, Lindsey Vonn was skiing in the Olympics, and God bless her. I hope she's okay. I woke up this morning, she had crashed again, and she had to be med flighted off the mountain. She was skiing she had retorn her ACL last week. And she posted videos. She was jumping with her brace on, and she was, able to do it because the brace is helping her to stop from hyperextending, and she's really strong. As a professional athlete, you are in the gym. That is your life. You are in the gym all the time, building strength, really working hard on skill, technique, fueling your body right, getting rest. These Olympic athletes are massively in shape and ready to go. Cheer athletes are not to that level of strength and conditioning. Now, I'm not saying your athletes are not in shape, but most do not have that same as a professional athlete. So unless they're going to be in the gym 24/7 and really having a team to build and get them strong, they may not be to the same level that they could just come off of ACL injury, put a brace on, and get out and jump, tumble, and stunt. Most of the time, they're going to require surgery. I'm sure Lindsey was going to have surgery. She probably is scheduled for a knee replacement after, but we don't know. I don't know what the surroundings are, and I'm not going to speculate. You can build strength, and people function 100% without having surgery on ACL. Especially at that age, I think surgery is a better option because the strength for myself, my leg is much stronger. And I'll talk about that in a second. But so again, you can function, you can wear a brace and get through the season without having surgery, but the risk is, more trauma to the knee. So after an ACL injury, if you're going to have surgery, you want to make sure that your range of motion is normal beforehand, that your strength is good, you can get a good quad contraction, and that you have the minimal swelling involved. So while you could wear a brace, the risk of trauma, and potential further injury like meniscus just sets you up for more damage and a longer recovery process, and may potentially mean putting off surgery. It takes a solid year to come back from an ACL injury. Yes, they get cleared at 24 weeks, but that's to start doing strength sports conditioning. So at 24 weeks, you start running. Well, you usually start a little earlier than straight plane running, but you can start jumping, and you can then start pivoting and cutting. Usually it's around 9 months that they can start doing the actual pivots and cuts. So if an athlete is going to be doing a round off into a back handspring, that's a pivot on that leg. If they're coming down out of a stunt and having to land hard, they need to have that control. So they need to really work on landings and, again, build that strength. So, we want to prevent these injuries because they're no fun to go through, because they require surgery, because it's a long recovery process, and then there's a higher risk of arthritis. I was very lucky. I was a physical therapist when I blew my ACL out. I worked in a physical therapy clinic. They were excellent with me, and I learned a lot from that process. And what I learned the most was that the best thing I could do was really build the strength up and do closed chain exercises like squats and deadlifts and lunges, leg presses, to get my quads and my hamstrings and my calf and outer thighs really strong so that it supports my knee. That made me a better skier in the long run. It actually made me a better stunter too, because I was able to go back and stunt with some college kids that they were trying harder stunts for me than I had tried. For a while, I was like, I'm not hitting these things. Why is that? I used to be able to do this, but they were more advanced than I had to remember that. It was 12 years after I finished. That was, anyways. My point being, you can get very strong after an ACL and get back, but you have to give it time. They may not be classified as a catastrophic, but because it's a season ending, mentally it is pretty catastrophic. And then getting back into doing, if they happen to tear during practice, it's scary getting back into that. So, taking that time and really building up the confidence, making sure they're strong in that leg will do a lot to help them get back. So the biggest drivers of catastrophic injuries, of course, is stunting, like basket tosses and pyramids and the transitional pyramids, athletes not that they're not ready. I do think that that's a big driver. And just from my own experience in watching my teams with their injuries, if they weren't strong enough, if they weren't quite, we always wanted to get to the next level. But if they weren't quite solid at their very basic level, getting to the next level to just then go chuck something puts them at a higher risk of something coming down. Somebody who's not solid in their tumbling may, if they don't have strong push off with their legs, they might not land solid in their hands and their arms. And then, like for myself, my arm collapsed. So making sure their athletes are ready and making sure that they are strong enough, that they have had the practice, that they are solid at a lower level before letting them progress. Studies do show that it's more practices than competition that the most severe injuries are seen. And that's great because that means we're not putting out something like a game day or a competition that isn't ready to go. So, I think part of it is natural because we're trying something new, but if they're prepared, it can make those injuries a lot less. In an article by Yao in 2018 called An Examination of the 2006-2007 Basket Toss Rule, he noted that over a 15-year period, there were about 54 catastrophic cheerleading injuries in high school and college, which came out to about 3.6 per year over that time frame. Basket tosses were a leading cause of these, and the rule change in 2006-2007, banning them on hard surfaces, reduced the catastrophic injury risk significantly. And then flyers were typically the person who was at risk because they were falling from a height and coming down on the impact that they have. Quite honestly, a lot of the bases, I think, because, for the most part, base isn't going to just toss up and walk away. They're trying to catch the flyer. Even if they don't quite do it, they don't intentionally walk away from a stunt, they're trying to do that. And then you have collision effects from there as well. Skill prevention, proper technique, and certified coaching is hugely important. We need to make sure that coaches are being certified and actually knowing what to do. I don't think a coach needs to know all of the mechanics in a stunt, but if they're learning something new, they need to know how to teach that. And they need to know when the stunt is ready to progress. I've quite frequently brought in other coaches to teach my kids new stunts because it was much different than what I was doing. But I had to learn what they were doing and how their hand position was supposed to be like. We couldn't throw basket tosses on the hardwood floors in basketball games, and my team was not happy with me. We found mats, and we found ways to be able to do that. We could pull in and out the mats, but making sure we were on a safe surface. We used to practice in college. We practiced in the quad and right underneath a tree. We were very lucky. We never hit that. You got to be aware of your surface. You can't be practicing on cement, especially if you're chucking something new. You got to be on a safe matted surface, making sure we're wearing proper footwear, all of the things, and making sure that the coaches don't allow the kids to be practicing on their own. I used to do it. We'd have practice, my partner and I would get together all the time. We always have a spot come, but that was in college, and while I still think coaches should be present so that they're not trying something that they're not ready to do, most college athletes are more aware. Someone that's 16 to 24 years old is going to be aware, like, okay, I need to be safe. I need to make sure I have the spots. They're going to know what it takes to get there. Youth athletes, they shouldn't be stunting on their own. They need to have that supervision, and they need to make sure they have a spot. And they need to know how to spot and how to catch. And every person on the team should know how to do that, in my opinion. Making sure you recognize what concussion symptoms are and following the return to play and return the protocols on that. It's very important. And of course, like we talk about all the time, conditioning, strength training, landing mechanics can reduce knee and ankle injury risk. I think having a proper warm up so that the joints and the tendons are ready to go and the core is stable and everything's kind of warmed up and ready, and then cool downs to loosen up, the stress that you had just done in your practice is also very important to prevent. And so that you can land and have good recoil in your tendons and joints. Landing mechanics, teaching your flyer how to fall and how to pull in, what body position they should be in. If they come down flying like, I think Grover running, right? Come down flying like Grover, they're going to put themselves at risk because bases can't catch them, and the bases at risk because they can't catch them, and they're probably going to get clocked in the head. So teaching them to come clean, pulling their hands up, pulling in tight if they're coming down and not freaking out is hugely important. If you go back and listen to the last couple of episodes where we talked about warm-ups and recovery. And in my injury prevention starter kit for cheer parents that's out for $5 right now, there's a bunch of warm-ups and recovery tips as well to keep you going. So check that out. My last year coaching, I had 5 girls go out with a concussion, and that's on me. That was my fault. They're all doing well now. I made them stay out. It brought our team of 11 down to 6. So our season was really non-existent. I made them stay out for a long period of time, which some parents were not happy with me, but I think it was better for them in the long run. And I would stand true to that because they had to recover. I think some of them had some prior concussions that maybe they hadn't recovered from and having symptoms and headaches. So I really wanted them to make sure that they were solid before they came back. It's hard to know on teenage athletes, right? When we're putting them in these events that potentially could cause a massive injury, but they're also going through puberty, and hormone changes, and that can create headaches, and it also creates distraction. And we have to be aware of this. As parents, it's important to know what your kid is doing, like how they are when they get home. As coaches, recognizing when your kid maybe not, your cheerleader maybe not quite right and maybe off a little bit. Could be around their hormone time and their period, or it could be that they got clocked in the head and they need to get checked out. When in doubt, get checked out. That's my other new one. When in doubt, get checked out. I think it's really important. So in conclusion, catastrophic injuries, they do have a high potential in cheerleading, and compared to other sports, they may not be as prevalent, and they definitely have reduced over the last 15 years, but they still can happen. So it's important to know the mechanisms and to decrease the fall risk and decrease those risks as much as we can, being prepared as best we can. I'll share some links to some articles in the show notes. And if you have any questions, please reach out. I have an Ask a PT form that I'll also leave. So if you have questions about your own injuries, or if you'd like me to talk on a topic, please fill that out. I'd be happy to answer any questions. And definitely check out the injury prevention starter kit. I hope you have a great week. There are a lot of things that we can continue to talk about. Cheer injuries, catastrophics are they're huge, and it does take a long time to recover. And most of the time you can come back, and there are some that you can't, but just be prepared and stay as healthy as you can to not have those happen. And then pay attention, like I talked about last week's episode, pay attention to the overuse mechanisms and, try to train and be healthy to help reduce those injury risks as you go forward. Thank you very much for listening to me this week. If you found this valuable, share it with another coach or a parent who may need to hear it. And just as a shout out to my Patriots, I'm recording this on Super Bowl Sunday before the game, so I don't know if we win or lose, but I am a Pats fan through and through. And so go Patriots. Whatever happens today happens. It's been a great, fun season, and I hope you take that as a takeaway also. whatever happens in competition this season, the point is to enjoy it. The point of sports is to have fun in the process, to learn something, to challenge yourself, to be better because of it. And follow that lead from the Patriots this season, whatever happens on competition, and just know that you can enjoy the ride and have fun in the process. Thanks for listening. Have a great week. Don't forget, when in doubt, breathe out. Take life one step at a time. You can do anything you put your mind to. And as my friend Drew Kelleher said, you're responsible for your own vibes. So go get the day.